Great. Hello, everyone. We still have some folks who are joining in our webinar, but so grateful for you to join us for the ASPPH webinar focusing on applying Framing the Future 2030, how a big, medium, and small unit are transforming education. My name is Sean Mohammed, and I am a faculty member at Northeastern University in Boston, Massachusetts. And it's been my honor to be the co-chair of the expert panel that created the Framing the Future report on transformative approaches to teaching and learning. I'm also the chair of the Education Advisory Committee for ASPPH and am so thrilled to be joined by our panelists today to talk about where we can go next in terms of the Framing the Future initiative. So each of our speakers will tell you a bit about themselves and their institution, but I just want to publicly thank each of them. Hillary Nelson, who's the director of the MPH program at University of Pennsylvania, Donna Gurley, who is the associate dean at Loma Linda University School of Public Health, and Ted Gideons, who is associate dean for undergraduate education at UC Irvine. So one of the guiding pieces of Framing the Future 2030 was to help each institution, whether they are a school or a program, big, medium, or large, really convene and have conversations about what is most important to them in terms of how they might move forward in terms of transformative education. And so this quote by Margaret Wheatley, that there is no power for change greater than a community discovering what it cares about, is a wonderful guiding light for us in terms of the work that we hope all members in ASPPH can accomplish. So ASPPH Framing the Future 2030, Education for Public Health, really grew out of this critical time period that we are living in. So not only in the past few years, but probably even since the reports were released in March of last year, we know that public health is visible and people are wondering about what we do and how we do it. And so we really are at a turning point. And so our goal is that these reports can help our institutions have those critical conversations that will help us seize this moment and respond to this moment because it is as much of a big challenge. It is a big opportunity for us to think about how we are going to move forward and most appropriately meet the needs of our communities, meet the needs of our learners, sustain our faculty and our staff who are endeavoring to do good academic public health work, and ultimately achieve the health outcomes that we're looking for in terms of reducing health inequities. So now that these reports are available, the purpose of this webinar is to really continue to facilitate conversations and help people learn from best practices or that was a good idea. It didn't work so well for us, but recognizing that we are all in this together. So the format for our webinar is we'll have three presentations. We'll have opportunities for audience feedback and questions, and then we'll wrap it up and be grateful that you've spent this time with us today. As we think about transformative education from a public health lens, from the ASPPH lens, our goal is to really think about how we support this critical exploration, the questioning of our assumptions, and ultimately work towards greater engagement and empowerment of our learners, and also using these opportunities to think about how we are making our decisions and how are we driving forward in terms of meaningful actions. So with this webinar, we want there to be ample opportunities for you to have your questions answered. So you'll see that there is an opportunity for you to submit your questions directly into the Q&A box. We encourage you to do that at any time as those questions and ideas or thoughts rise for you. And we'll have time at the end to address as many of those questions as possible. But to get started, we thought it would be helpful because there's such diversity in our institutions to just get a little sense of where you are coming from in terms of engagement with framing the future. So if you can take a few moments to answer these two simple questions in terms of um, how you've engaged with the Framing the Future reports, and then also if you've shared those reports outwardly. So we'll go ahead and we'll um, launch that quiz and have you answer those questions. And while you're doing so, I'll just make a few comments that reflect the diversity of institutions that are participants in ASPPH. And this was something that was really informative to me when I was working with the Framing the Future panel. One thing is that we have great diversity, obviously, in terms of size, which is why we are hosting this webinar, but also in terms of political landscapes, where our institutions are located, if our institutions are public, private, religiously affiliated, whether they are online or on ground. Also, the size of student enrollments ranges from, 20 students to over 3,000. There's great diversity as well as the number of faculty that we have working with us. So let's see what the results show. Great. So this is helpful, right? In terms of folks who have had a chance to look at the reports and those who have not, we're sort of in the exploratory phase. So we really will encourage you. We'll put the links to the reports into the chat by the end of the webinar. And then in terms of where people are sharing out these reports who have taken a look, this is also really interesting, right? In terms of, we know everyone has limited time and energy. And so this idea that, yes, it makes sense that fellow faculty would have seen these, but in terms of senior leadership or staff, maybe a little less so. And then in terms of actually sharing this with our students, that could be a great opportunity for us to think about, particularly because in those reports, you'll see that there are guiding questions or deliberative guiding questions that are really meant to be part of a conversation with multiple levels or what we call drivers of academic public health, including senior leadership, fellow faculty and staff, and then community partners, right? So as you look at those questions, you may recognize these are great questions to approach learners and in terms of community partners as well. So thank you for that feedback. That's really helpful for us to understand. And with that, why don't we go ahead and get started? And I will turn things over to Hillary Nelson, who will be our first speaker.
Thank you, Sean. So I am the director of the Masters of Public Health program at the University of Pennsylvania. Penn has had an MPH program since 2003, and we're a little bit unusual. We're not a school of public health. We only offer an MPH program. We have 4 concentrations that share a common core curriculum. We also have about 16 dual degree options, and about a fifth of our students are dually enrolled. We're an in-person program with a mix of full-time and part-time students who take the same classes. Because of this mix of student types, we don't operate on a cohort model. And our current student census is about 126 students this semester. The really unusual thing about our program is that we're not affiliated with a department. This is typical for the University of Pennsylvania, as their graduate education relies on graduate groups, a group of faculty who don't have to be from the same department, let alone the same school, who work together to educate students in a specific topic area. We are affiliated with the Penn Center for Public Health, and for those of you who speak fluent CEF, the center helps us with our Section F accreditation requirements. Because we're not a department, we have to borrow faculty from across the university to teach in the program. This is not too difficult because there's quite a lot of public health being done across campus, despite the lack of a school of public health. These faculty opt in to teaching in the program for 2 reasons. They are looking for camaraderie of other public health folks, and they are passionate about teaching the next generation of public health professionals. And we currently have about 40 teaching faculty, some that work their full-time job at Penn and other external public health professionals that we bring in to teach. But I'm not a department chair, so there are limits to what I can ask my colleagues to do. So, oops. So the first thing that I did when thinking about how to approach the framing the future was to generate a lot of enthusiasm among the teaching faculty. Because I sit on the ASPPH Education Committee with Sean, I was privileged to see early versions of 2 of the reports. And once all of these reports were published, I sent the PDF of the executive summary and the links to the other reports to all of the teaching faculty. I also attended the 2024 ASPPH annual meeting with a colleague, and we then reported back about how amazing the Framing the Future 2030 was. So all of this constant emails talking about how great this was. The next step was to get buy-in from key leaders. Our first steering committee meeting of fall 2024 was focused on framing the future. And I convinced them that looking at the Framing the Future reports was not only important for our continuous efforts on program improvement, but also, and importantly, that it wouldn't take that long. Here's the key. I convinced the steering committee that the ask to faculty would be for 2 hours only, 1 hour to read a report and think about it, and 1 hour to meet and discuss ideas. I was also able to convince some MPH team leaders to agree to lead the ad hoc subcommittees for the different reports. With the proviso, they all asked that I had to do the email asking the committee members to be on the committees. I want to make sure to give the MPH team leaders credit for the heavy lifting. Anita oversaw the Inclusive Excellence Report. Nakia oversaw the Community Engagement Report, and Dominique oversaw transformative approaches to teaching. And Jua, our associate director, sat in on all 3 committees to sort of see what the cross-cutting themes were. The ad hoc committees were mostly faculty, but we also included some students, alumni, and other friends of the program where appropriate. While we admired the extensive list of objectives in each report and all of the guiding questions that Sean had mentioned, going through everything was beyond the scope we could do as a small program. Therefore, we used 2 questions as the basis for our ask to the committees. First, what are we already doing that was suggested in the reports? In other words, what are our wins? Second, are there ideas that we could easily do? In other words, what are our low-hanging fruits? And one of the things that whenever I talk about this, I get asked by people, what was the email you used? Because I got 100% acceptance. And my email template can be seen at that link, and you'll be getting the slides, so you'll be able to take a look at it. All right, so the leaders of each group reported back to the steering committee, and what became very obvious was the existence of cross-cutting themes from each committee, and this is something that Ajua reported back on, because she had attended every meeting. First, we are already doing a lot of the amazing suggestions in these reports. For example, we already have a core class on public health law and ethics, and increasing the amount of law and ethics in the curriculum was one of the recommendations. Second, we don't do a very good job at touting our own horn. I mean, I know that we're an amazing MPH program, but we need to talk more about it both internally within Penn and also externally, like I'm doing now. Third, community engagement is critical to all 3 topics, and we really could be doing a better job on that across the board. But what are our wins? Here's a sample of things that we are doing well. First, we already give honorariums to community members who come to our classes. They are the experts, and they get the same stipend as any other expert we bring in to lecture to our students. Second, we have a mission-aligned application and scholarship review process with a focus on supporting students for whom the MPH is the terminal degree. Almost all of our classes utilize innovative approaches with authentic assessments and active learning components, and our faculty is always keen to continue to improve. Finally, we offer an innovative preparation course for students prior to doing their APE. This asynchronous, non-credit bearing course not only teaches them about the history of Philadelphia and Penn's relationship to the city, but also about different cultures and groups that they might be interacting with. But what are some of the things that we could be doing better? What are the things that we could implement? What are the low-hanging fruits? We need to streamline our APE sites with better training for both students and preceptors. We need to provide longitudinal support for the sites, and we are in the process of implementing this. We also need to identify more civic engagement opportunities for students and faculty. And finally, despite our great APE preliminary course, we need to do a better job of getting our students into Philadelphia neighborhoods. We are a program that really takes advantage of Philadelphia as a key part of our education. There were suggestions that will be harder to implement, if at all, given institutional barriers and our own unusual position within the university as a graduate group. We have a hard time identifying Penn faculty who are not only willing to teach, remember they have to opt in, but can teach specific topics. One of our workarounds is to find local experts, but I spend a huge amount of time cultivating my contacts to identify new instructors, and will continue to do so. Our one idea for getting our students and faculty to do more community engaged work that the committees came up with is to provide financial incentives. Unfortunately, we don't have the resources to do that. We're looking for ways to overcome this, perhaps by identifying development funds. And finally, there was also the recommendation that we provide more support for APE sites, especially small nonprofit groups. However, the university limits us in what we can provide. For example, we can't offer library access to online journals. But one of the things we do is that we have learning institutes, and we are keeping our price very low at an affordable rate, rather than making money for the Penn Center for Public Health that offers these institutes. So we're not, we're trying to break even, and that allows these small organizations to have their staff gain additional public health skills. To summarize, our steps include enthusiasm for the process, buy-in from key leaders, limit to 2 questions: what are our wins and what are the low-hanging fruits that we can implement? And then use this process to spur creative new approaches, rinse and repeat. With that, I'm going to turn us over to Donna, who will talk about a medium program.
Thank you, Hillary. I'm Donna Gourlay, and I am the academic dean for our School of Public Health. A little bit about who we are. Before I talk about our transformative approach to education, we are a faith-based health sciences university in Southern California. We've been here for a little over 120 years. Our school is just celebrating starting its 60th year being a school of public health. We're one of 8 schools on our campus. We have been focused on graduate education up until now, and we have 13 graduate degrees, 9 of which are offered online. So the majority of our students each year, we've seen a growth in online education, and because a lot of our students are working professionals, they appreciate and enjoy having an online experience. I want to give a shout out to 2 groups of our recent graduates. The young lady on the left is from one of our local First Nation communities. She got her DRPH recently. And the two ladies on the right are African Caribbean, and they are a mother and daughter duo that received their doctoral and master's degrees in the same year. So we love our graduates and we celebrate them often. So for framing the future, I want to talk about a couple of things that we're doing already and then go on to our new initiative. The first one is no matter what happens in Washington, we at Loma Linda University will always value diversity, equity, inclusion, and belonging on our campus. And in 2021, we were honored to receive a minority serving institution designation for Hispanics, and then Asian American, Native American, and Pacific Islander minorities. So we absolutely value that designation, and we pride ourselves in being a diverse campus. Even though we're a relatively small university, our School of Public Health has about 300 students across all of our programs. And we have gotten a number of HRSA grants to train the workforce, public health workforce, and we are going after our next HRSA grant for that as well. So we are doing our very best to try to mirror what our community looks like as far as our students. The second initiative that we've been working on for, a very long time before framing the future, and that is developing community partnerships. We have had a number of things that we've worked on with our students and our faculty, and I just have three things as an example. One is service learning. And every student that comes through Loma Linda University has to have at least one university-approved service learning course. I can talk a whole presentation about all of those types of projects. We also have local and global projects that our faculty are doing either research, practice, or service, and often include our students. And we partner with a number of organizations. You can see the list here. And another thing is our student international mission service trips, which we have about 20 each year that go out across the globe. And we partner with a local church to help identify what a health need is for that community and send students from all over the campus. So we could have a clinic, or we could have a health fair, or we could have a health education event or nutrition assessment. We've done a variety of things and partnered with our fellow students and schools. So those are things that we have enjoyed doing and we will continue to do. I want to talk a little bit about, which you may or may not know, but we have at least a perceived misalignment between who we are as higher education, not just public health, but higher education in general with the American public. And so we've, I'm sure, read and heard the statistics that people just don't value higher education anymore. And I think we have an opportunity, as Hillary mentioned earlier, we don't do well in telling our story. I don't know if that's just public health, but we really have to share our stories and how we've been successful and the wins that we've had with our communities, with our organizations, and with our students to draw more people into the discipline of public health. But we know that college graduates earn twice as much over their lifetime as those who just graduate from high school. And we've seen almost a doubling of student debt over the past 10 years. And so some of those things have really caused the American public to say, do I really need to go to get a degree, or can I go get a tech certificate and go work in IT or do something like that and get a good paying job? So one of the things that we have done, this is our initiative, is a bachelor's degree in 3 years. So we've been part of the College in 3 exchange discussion, which has been happening at the national level for probably at least a year. And Loma Linda University has been part of that, specifically our provost's office. And so there are a number of states that have either have 3-year degrees or have an initiative to start a 3-year degree. They're all different though. There's no standardized format. So our college in 3 is looking at reducing not only the student debt, but also their time into the workforce, and then looking at, are they ready for the workforce? So I'll talk about that. We've also, I attended a college in 3 presentation about 2 weeks ago, and there's mixed reviews. And there's some things that have kind of halted or stalled our progress in this space. So let me talk about that for a little bit. In doing my presentation for our proposal for this 3-year degree, I was kind of surprised to find, you may already know this, but I was surprised to find that the reason why we have a 4-year bachelor's degree in the United States is this was a recommendation done about 100 years ago from the Carnegie Foundation to say that when they're looking at a faculty to retire, so their retirement benefits, how many courses would they need to teach over how many years, and that led to the recommendation of a 4-year bachelor's degree. I know the Carnegie Foundation has since recommended something different in this past, probably in the past 5 or 6 years. We also have our peer countries who have 3-year bachelor's degrees. And we have accepted students from other countries who have a 3-year bachelor's degree, specifically from Canada, into our school. So there's precedence that a 3-year bachelor's degree is not only doable, but acceptable. So with our university, with the School of Public Health, we have actually 3 3-year bachelor's degree proposals that are sitting with WASC, our regional accrediting body. We've had conversations with SEAF and they are supportive. They've said we've talked to other schools of public health that are interested in doing this. We just haven't received a proposal yet. So our 3-year bachelor's degree would be considered an accelerated. So we're not taking 4 years and cramming it into 3. We are actually reducing the number of units. So we're on the quarter system. And so from 180 units, which is our minimum for a bachelor's degree, we've changed our policy at the university level to allow for a 3-year bachelor's degree, which would be 135 quarter units instead of 180. We will still focus on the delivering the SAFE competencies for undergraduate education. In addition, we will have 5 program learning outcomes, which have been proposed. Our discipline concentration will be in global health, which will pair with our MPH in global health. And so the students will have not only their service learning, but they'll actually be going out with our master's students to work on, to assist them in working on their graduate ILE projects. We've been partnering with the sister organization in Malawi for the last 5 years. Before that, it was Philippines. So what we try to do with our global health program is to partner with an organization, whether it's a nonprofit or a faith-based organization in another country, and send students over a period of probably 4 or 5 years to make an impact on that community. So essentially what we're doing is we're eliminating electives and general ed GE courses. So the first 2 years, our students will be in the curriculum that is part of, that is our associate's degree in health sciences. And so they will be getting their English, their writing, their public speaking, their science, the humanities, all those different types of courses that they'll need. They'll concentrate that in their first 2 years. The 3rd year, they will be focused on global health, and then go out with our master's students that summer to assist them and hopefully get them involved or interested in a master's degree. If they're not, they will be trained and prepared to go out into the workforce. And we've listed a number of jobs that they will be qualified for. We also have a partnership with 2 other schools on campus, behavioral health and allied health. So graduates from that program, if they choose to go in the workforce, or they go on to a graduate degree, they would get priority consideration for a master's degree in either public health, behavioral health, or allied health. And again, we have kind of put a pause on this, looking to see what's happening at the national level and also within the White House as far as accreditation. Not only do we have a change in leadership administration at the White House, but we also have a change in administration in our local accrediting body. And if the Department of Education goes away, as I understand, accrediting would shift back to the states. So we're waiting to see what's going to happen. But we are confident that this will be moving forward. And I'd like to turn the time over next to Ted, who is from UC Irvine, just down the street from us.
That's where I want. Sorry, the controls just root. So I'm Ted Gideons. I'm the Associate Dean of or for undergraduate education, depending on who wrote the slide, at UC Irvine's new Josie Wen School of Population and Public Health. And they came up with the title of this during our sort of planning meeting when I realized that there was only carrots for doing Framing the Future. There's no stick. And we have a very large program, and I'll sort of talk about sort of the facilitators and barriers, sort of the classic implementation stuff for UC Irvine's approach to this. So just some background. So we have the UCI created a program in public health 19 years ago. And very quickly, we had 3 years later, we had MPH students, and then 2012, we had our first PhD students in epidemiology, then first PhD students in public health. And in fact, I remember sitting there when I first arrived in 2016, and I was like, well, there aren't very many PhD students. So we had TAs from all over the place. It's very different now. Mike started my full-time sort of tenure track teaching professor job in 2018, and I was asked to join to be the rep for ASPPH's inaugural Diversity, Equity, and Inclusion section. And this was a big deal for me professionally, but also for ASPPH, but in general, it was transformative in many ways for me, just my own experience, but it also, I think, in many ways transformed how our program came to be. In 2020, as we were in the process of creating, and this is a very classic University of California, we had to do a pre-proposal before we did a proposal to become a school of public health. I worked with a couple other faculty members for the inaugural inclusion and diversity plan that was for our pre-proposal, which was, I can't even imagine how I would have been able to do it without the experience and the guidance that I got from that diversity, equity, include the DEI section, and leadership. So it was very much like in our mind, the things that ended up being, I would say, part of Framing the Future, but sort of an attitude and a way of looking. And then, of course, COVID happened in 2020. So all as well as the Black Lives Matter movement sort of reaching its peak. So there were a lot of things going on. We entirely over Zoom. We finished the pre-proposal for the School of Public Health that was submitted in 2021. In 23, we finally submitted the final proposal for that school. And before we were actually announced as an actual school, we had the first dean Associate Dean for Diversity, Equity, and Inclusion. That's Marizan Ramirez, who came from University of Minnesota. And then in 2024, a few months later, we released the Framing the Future. I was part of the expert panel that worked on the building inclusive excellence through an anti-racism lens. So being part of that meant that I was very much involved in the discussions and thinking about how we were going to do it. And then we actually became a real school in July of 2020, which was, when I was hired in 2016 as an adjunct professor, one of the things that was said to me is, we're about to become a school. So that was 8 years later, it finally happened. And I'll talk a little about that. But now we have this situation 6 months afterwards. The Trump administration, the second Trump administration began. And when you're focused on the the part of Framing the Future, as I was, which was inclusive excellence through an anti-racism lens, that would be constitute truly a barrier to what we are doing. So just some numbers and context. When I started, there were 13 faculty members. We are now at 40 faculty members and 4 departments, 3 which were original departments across the university that had a shotgun marriage in 2019. 1 split became 2. There are more faculty coming from endowments, things like that. We have 60 staff, and we desperately need at least 20 more to be able to do all the things we're doing. We have 1,300. While I've been there, we've had between 1,200 and 1,400 undergraduates. We currently have 1,384. That's exactly the number. And 85% of them are non-white, 60% of them are first gen. And that has a lot to do with sort of how we think about going about doing things and how I thought about the work that I was doing on the Framing the Future panel. We currently have 77 MPH students. There were 20 a few years ago, and the goal is to have 200 in the next several years. And we have currently 85 PhD students. No one has any idea whether that will go up or go down based on certain situations. There's the national administration, federal administration issues, but also the fact that the University of California, after a major grad student strike, we now pay our grad students 100% more than we did. So, and it's become very expensive for good reasons, but it is an issue. So also, just how big is this? So we're one of 15 schools at UCI, and we are one of 5 public health schools in the UC system. There are other programs, but system-wide, we have 300,000 students and 265 faculty and staff. So that is a very large city, and so subsequently, the bureaucracy is rather extensive. It's legendarily thick. And there is a huge amount of political involvement from the governor, from the legislature, from local, but also because we're famous, national focus on the things that we do. We also have a huge, robust, and very active unionization of grad students, of staff, and we also have a lot of a global reach. So the things that we do end up having an effect internationally, which creates a huge amount of pressure, particularly from the countries where most of our graduate students come from, like China, Taiwan, Korea, India, et cetera. So our relationship to ASPPH is and particularly my relationship is sort of as I mentioned, the DEI section really influenced the original proposal about how we were actually going to go about doing our things. The sort of publication that came from the panel I was on was creating an inclusive workspace through an anti-racism lens, and that guided how we created our rather large DEI council in 2023. I was thrilled. When I joined it, it was actually, Marizan had already is like, this is a great way to do it. And I was like, oh, I didn't even have to say anything. It just happened because it's an amazing document. After the Freedom Future actually came out, we did have structured discussions in an all-school faculty meeting in spring of 2024. I will admit, though, let's see if this actually, there's a cricket. It was crickets. And I will say there's a lot of reasons why it was crickets. And some of it is, God, we have a lot going on. But some of the stuff had to do, and I'll talk about why some of the cricket stuff has to do with the facilitating it is, we're already doing a lot of this. So the new school and the program is we branded ourselves focused on health equity. And that's from our APHA meetings. And actually, it's a bunch of amazing, unbelievable grad students that have TA'd for me. So we're already doing a lot of this stuff. We also, we have faculty members that are hugely deeply involved in research, extensive research at secondary, both quantitative, qualitative, brand new secondary research focused on racism, anti-racism, equity research and practice, which is a huge issue because a lot of our grants are probably going to disappear. But we do this stuff, a lot of our federal grants, but I think we're figuring out how to go through it. The UC system also has an unbelievably robust commitment to DEI practices, and they have reiterated it multiple times over the last month, which is fantastic. It means that it's also sort of old, so there is a enforcing it is weird because there's a lot of stuff we already do. Some of it might be lip service, but it is robust. It is incredible. It's embedded in our hiring and our promotion practices rather extensively. And it is still there, and it is still there in recruitment as well. And we also have a lot of lawyers. So when they told us that we couldn't do things, as I was said, we will not break the law, but we will. We also have a lot of lawyers. So there are a lot of barriers too, because we have a huge number of competing priorities. It's a brand new school. And while we prioritize the top similar topics, the actual specifics are very different. And I did a screen grab of our like the school's blog and news feed. And those are all the topics that we are talking about in the last 6 months. So there's a lot of stuff that overlaps, but there's also a lot of stuff that is going on and that people are focused on. So there are similar initiatives already in process, but there's some things that we really wish that we could be focused on. And I've talked about some of it is difficult, some of it is, but the bureaucratic morass of UCI, but in the school, just simply getting, for instance, getting like post award support to get from point A to point B is very difficult. Grants that we might use to do some of these things may take a long time. We also have, as we keep adding faculty members, we don't know the people very well. So working with people to create transformative change with people, when you have 20 new faculty members over the last 3 years, you have to figure people out. This is not, without a stick, it's all about relationship building. So there's a lot of new people that we're trying to figure out. Also, those of us that are specifically focused on this stuff, there's a lot going on and it's exhausting. We talk a lot about the emotional labor of DEI work, and it is incredibly difficult to do what we're doing, and we have to constantly respond to so many crises, obviously, around us. Yeah, and so that is the last thing, was that it sparks conversation, but it doesn't mandate policy. But it has guided a huge number of of conversations, and some of which we are able to really inspire us. And I love this picture of our dean walking with all of our people, because it is the inspiration that we get is profound from the Framing the Future stuff. So hopefully we'll be able to do more. And I will turn it over back to Sean.
Great. Thanks very much. So we definitely want to use the remaining time for questions. And Liz, I think if you're able to pull up the slide with the QR code, but I'll draw people's attention to the Q&A box to submit any questions that you have for our panelists. But I think I'll pick up, Ted, where you left off with a question, and this is open to any of our guests, which is really this idea of how can we bring attention to teaching and learning? How do we frame that? How do we manage it, bite size, et cetera, in terms of when our faculty and staff are struggling on all sorts of different fronts, whether it's institutional challenges, whether it's within our states, whether it's the uncertainty around the federal climate. I wonder if any of you have any initial thoughts about how we pivot, right? I think that's what we're talking about. So anybody have a
I could say one of the things that we did was we created a director of innovative teaching. Prior to that, it had been mostly on my shoulders, but now there's 2 of us. And we've just let all the faculty know, like, you're not in this alone. And we are here to brainstorm. And at our faculty meetings, we encourage people to bring up issues. So people are willing to innovate because there's a culture of innovation in education, but also there are others who are willing to share their ideas all the time. So it's really creating that, much as Ted talks about having that culture of DEI, and Donna talked about the culture of mission-driven service. We have a culture of innovating in education.
One of the things that I think is that maybe it's just the way that I try to sort of reframe things, is that pivoting there's pivoting, like real pivot, like, oh, I do something completely different. But this is what's happening is public health. So teaching the actual situation. Now, there's some things that are like, distant, but like a lot of what's happening to the CDC or NIH or vaccines or whatever, this is teaching public health. So leaning into the problem, which is stressful, but it is also, I think I've tried to get our instructors to say, tell them that you're freaked out too. Like, admit that this is like really difficult, and to lean into it, because the students are thinking about it. And I think that one of the things is that people are like, well, I don't know how to do that. And it's like, well, here's an innovative way to do it. So there's a way to sort of, some of it is we need to do it because for our own, but I think leaning into it with the students is really important. And I think it really creates incredible opportunities for innovation and in the teaching too.
Thanks, Ted. Donna, any thoughts and reflections from your perspective?
Well, similar to the comments that Hillary and Ted made, and that faculty need to feel alive in transforming their education and their learning, that they're supported. As we found this in when we went to Zoom, pivoted to Zoom during the pandemic. Faculty are, they're hired to be experts. They're experts in their field, but technology oftentimes is not their expertise. And so giving them training and support that it's okay, you'll have a TA to help you with things if you need that. So it's really supporting the faculty and letting them know it's okay. And then also, as you both mentioned, communicating with students, because there's a lot of uncertainty and a lot of unknown at this point in time, over the last probably month. And so we're all trying to work together and talk about things and be in the space together.
Thank you so much. And I think your comments really highlight some of the recommendations and reflections about, in our job in academic public health, what does practice readiness now need to look like, right? How do we re-ask and how do we rethink what these kinds of questions are? What kind of relationships do we want with our community or partners and our organization? So thank you for that. We do have a question, and this one, Donna, for you. At Loma Linda, how has your team navigated the question of how employers or grad programs might view a 3-year program compared to a 4-year program?
Excellent question. We met with, I met with our dean's external stakeholder task force, and they had that same question. We met with the academic council, University Academic Affairs group, and within the university, which represents all the schools. They had the same question. And as we have learned, seat time does not equal education or learning. We've also had a number of people that have gone through training, and we've done a lot of listening and a lot of asking and trying to find out what are the things that employers need from a bachelor's prepared workforce. And so I think the big thing is we have a unique situation in public health in that we're competency based. And being on a health sciences campus, I am surprised how many health professions are not competency based. It is pretty interesting. And so I think we have a huge advantage in that our competencies are based on previous Framing the Futures documents as far as what do we need, what do our employers of our graduates, what are they looking for? And actually speaking to that, training our students for those competencies, and now extending that to an undergraduate education, because as I understand, undergraduate education is new to me, the SEEF competencies, the SEEF standards for that. And so I was like, where are the five? So we just automatically extended 5 learning outcomes to our undergraduate degrees that will speak to what are the things that they would need to be doing in the workforce if they decide when they finish a bachelor's degree, they should be ready for that.
Great. Thank you. One of the pieces as the 3 expert panels were doing their work was that the goal was not to add a burden to programs, right? It wasn't about creating new competencies, et cetera. It was really to help programs and schools reflect on how might they think and re-envision the work that they're doing. So Hillary, I'm just curious, thank you so much for sharing for a small program, sort of what's reasonable, feasible to do. But were there any challenges that you didn't discuss in terms of implementing the Framing the Future framework, or just deciding what to do with it, or what you could do with it?
Oh, lots of them. I mean, I think predominantly structural and institutional barriers were a big one. So a lot of the comments came back, and would say to a JUA, love to do this, we don't have the money. Love to do this, the university won't let us do this. And I think, in the past month, there have been a huge number of barriers that have come up that are going to continue to be an issue. I'm really glad we went through this thought exercise in the fall because it was an optimistic type of exercise. But yes, I did have to say, ooh, love to be able to do all of the suggestions that the wonderful subcommittees came up with, and just not going to happen right now.
Right. Yeah, thank you. And I think that's the piece that it sort of ties into, Ted, your point about it's all about relationships, right? You can't have these discussions and tell people no, 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 if you don't have the relationship to be able to explain the situation and have the trust that you value those ideas and that they're important. So Ted, I'm wondering if you have any additional comments, particularly in light of our political climate and DEI. Like, are there approaches that you're taking in terms of really supporting those relationships, and I guess maintaining hope, right? Ultimately, that if we don't have the hope, then we don't have the energy, et cetera. So are there any particular approaches, particularly because you have so many students, right?
Yeah.
And it's such a big operation. How do you think about that relationship building?
So, I mean, what we have, it's a lot of students, but it's a lot of very specific students that, I mean, the first gen students, but also UCI has among the largest number of DACA students of any school in the country. And so we have a lot of students that are scared about certain things, but they're like, oh my God, is public health going to still exist? And I was like, okay, well, the CDC and NIH are problematic, of course, obviously, but California is not in certain ways, but also there's a lot of, pointing out we're going to still have to do some of these things. It's if the federal government is going to pay for it, we will have to do it. Every state's going to have to start in, figuring out like, how are you going to inspect the chicken coops if the USDA doesn't exist? So there's a lot of stuff where we are pointing out, it's like there's jobs, but there's also incredibly important work. So it's awful to say, like, in the sort of like in a capitalist way, it's a growth opportunity, but there's a huge opportunity of like, as things go away, that we need to build things. So there's a lot of hope I have a lot of hope because I have 1,400 undergrads who have decided to major in public health. I mean, it's profound. Like it made honestly working through the pandemic a lot easier because I was talking to people that wanted to go back to their community and do stuff. So there's a lot of hope there, but I think there's also a lot of understanding that relationships are incredibly important on multiple levels. So it's not just like being able to, you need to talk to people to figure out how to get things done. But you also need to make partnerships with on multiple levels with whether it's the government, other schools. And this is something that we talked about in the DEI section ASPPH, which is as Texas and Mississippi and Florida collapse their DEIs, there are other places that are bolstering them. So there's a lot of stuff where it is the collaboration that I felt through organizations like ASPPH or other sort of or smaller organizations that really specify that relationship building is also solidarity, is also inspiration. And you get all these ideas and you get these other people that you know you can go talk to. I mean, I'll go to any undergraduate public health event because the people I meet there are these true believers that want to do something. So there's that the hope comes from working with the people that like I want to make people live longer and better and happier. So and I think that we have it pretty good in that way because you don't do this unless you have hope. So I get, from the students that are like, oh, I want to go do this. They do. It's so it is, I mean, I try to, figure out how to work within the context of what we're doing. It is really hard though. Because I'm not 22 and have, optimistic hope like they do. But it is how we have to do it.
Right.
I think though that this time presents an amazing opportunity for our
Yes.
field. We need to really go back to our basics and rethink what is it about public health that is so important. Much as I said, we don't do a good job about communicating how great we think our MPH program is. And then Donna followed up and Ted followed up. We don't do a good job about communicating the importance of public health. Public health isn't going to go away. And I think that, and we're not 22, but our students are. And what we say to them right now is, this is your opportunity to take this field where it needs to go. This is your opportunity to reframe the importance of public health and to really tell us what is needed to be able to ensure that we have a future. And so, maybe I have the advantage that I'm focusing on graduate students and some of my graduate students are more in their 30s and 40s, but I do say, this is your time. You tell us, you lead the way and we will follow and we will support you. So, they can be innovative and we can provide the education framework for them to innovate.
Great. Thank you. And I think you're so right. It's really about we need to rethink how we communicate what we do, right? We do
Yeah.
good work. How do we communicate that across the spectrum of audiences that we have in our area, in our state, et cetera? So we're just about out of time. I just wanted to highlight a few of potential next steps for everyone to think about as we move forward. One is to continue to share and review these documents. Maybe it's kind of like a Rorschach that depending on the moment that we face, that these reports have something unique to offer and we see things a little bit different. They are very rich and very full of information. So I definitely encourage those of you who have not seen all three to take a look at those three. And Liz, if you go to the next slide, we think about how do you do what we've heard, like an honest assessment? What can we do? What is possible? What's not? Develop a guiding North Star that's reasonable for your organization. That's our goal, is to transform our academic public health initiatives. And the next slide is a reminder that we are the ones who get to build this future and that we are all in it together. So we are grateful for our speakers. Thank you to each of you, Hillary, Donna, and Ted. Really appreciate your thoughts. Thank you to Liz and Brian on the back end at ASPPH who have helped coordinate this all. Next slide, the recording and contact information. If you have any questions, please feel free to reach out. And we have another upcoming webinar that ties in directly with this content, how to engage public health officials online, strategies for effective communication. So we hope that you will all join us for that as well. So thank you all for taking time out today and being with us. We really appreciate it.
Thank you, Sean.
Thank you. Honored to be presenting with Donna and Ted.
I'm thrilled to do this. Thank you all so much.
We're all
And
in it
also,
together.
read those reports. They're absolutely incredibly helpful and easy to follow through. So I highly recommend it. They're great reading.
Great. Thanks, everyone.
Thank you.